Good evening, medicos. Welcome to our channel, Medical Students Corner. Myself, Dr. Krishneswari. So, in the last class, we were dealing about the ECG. That is, we are coming through the surface anatomy of heart, circulation, cardiac cycle, ECG paper, etc. And today we are going to the components of ECG. Okay, the components of ECG. So we all know that ECG is a complex, is it not? It is not a single thing, it is a complex. That is, there are so many things which forms an ECG. So in ECG there are so many waves, there are so many segments, there are so many intervals and all. So today we are focusing on the waves of ECG, deflections in ECG, waves or various deflections in ECG. Okay, so there are how many waves? Can you guess? So we will draw ECG. So this is a typical ECG, typical normal ECG complex. So the deflections, the upward and downward deflections are known as waves in ECG. So this is P wave, this is Q, this is R, this is S, this is ST, and this is U. Okay, so there are 6 waves, is it not? 6 waves, that is 6 deflections in ECG, and P, Q, R, S, T, and U. Of this, Q and S is the negative deflection. Q and S is the negative deflection, that is, it is deflected downwards from the base, and P, R, T and U are the positive deflection, that is, they are looking upward. From the base, they are looking upward. You understand? So there are negative and positive deflection in ECG, and there are 6 ECG waves in a ECG complex. In this class, we are dealing with the waves of the ECG. So they are P, Q, R, S, T and U. Clear? So, in order to understand the waves, we should understand about depolarization and repolarization of the cardiac muscle. Depolarization and repolarization. Okay, so we will have some important things regarding the depolarization and repolarization in order to understand about the waves in ECG. So, there is something known as action potential. Action potential. Action potential. Okay, so we will see what is action potential. Suppose this is the cardiac cell and this is the, suppose, okay, this is the cardiac cell, this is the membrane of the cell. So in the resting phase, so what happens is, in the resting phase of the cardiac membrane or cardiac cell, what happens is, there will be positively charged sodium ions and positively charged calcium ions, sodium ions and calcium ions outside the membrane. So this is the membrane. Okay, this is the membrane. So outside the membrane, there are 2 ions, positively charged sodium and positively charged calcium. So what happens? Outside the membrane, the potential is, or the electricity is positively charged. You understand? Positively charged. And inside the membrane, what happens is, there will be positively charged potassium ions. Positively charged potassium ions. Understand? So what happens when compared to outside, inside there is less positive charge. So this outside is positively charged and inside it is less positively charged when compared to outside the membrane, or it is also known as negatively charged. You understand? It is not because of negative charged ions are present, but when compared to outside, this is, inside is less positively charged, and so it is known as negatively charged. You understand? So this is the normal resting phase in, as far as a cardiac cell or cardiac membrane is considered. So what happens is, the difference between these two, okay, the positive and negative charge is known as action potential. The difference between these two, what, electricity or electrically charged, is known as action potential. You understand? Next, we will talk about depolarization. Depolarization. So what happens in depolarization is when there is excitation of the particular membrane or muscle. So when there is excitation or when there is a stimuli, what happens is, so when there is a stimuli, there is a stimuli. What happens is this sodium ions will be moving inside the membrane. Sodium is present outside the membrane. This sodium ions will be moving inside the membrane through fast channel. Through fast channel, and calcium will be moving inside the membrane. Through slow channel. You understand? When there is excitation or when there is a stimulus, sodium will be moving inside through the fast channel and calcium will be moving through the slow channel. You understand? And what happens is, so there is potassium inside, is it not? So what happens is potassium will be moving outside the membrane. So there is what? Interchange of these ions. Interchange of these ions. So sodium will be moving outside. So what happens? There will be positive charge inside and negative charge outside. Understand? There is changing of these charges. Charges are interchanged outside and inside the membrane. So what happens? There will be production of an electricity. Understand? Electricity. And this electricity will be caught in the electrodes of the ECG. Understand? So this is depolarization. Next, there is a term known as repolarization. Repolarization. What happens is the reverse of this takes place in repolarization. That is, sodium and calcium will be moving outside and potassium will be moving inside, and again the membrane or cardiac muscle or cardiac cell or cardiac membrane, it will be in the resting phase. It will be in the resting phase, and this is known as repolarization. Again, in repolarization, what happens? There will be an exchange of ions which leads to a cardiac electricity production. So it is also caught in the electrodes of ECG. You understand? So this is regarding depolarization and repolarization. And let us see the waves. We have told about the waves. No? Let us see when these waves are produced. Very, very important. You should remember this. You should not forget this. If you forget depolarization and repolarization also, no problem. But you should not forget what I am going to say. Very, very important. So this P wave. It is produced during atrial depolarization. So when the atria contracts or when the muscle contracts, P waves are produced, and P is concerned with atrium. Then QRS, QR and S. These waves are produced during ventricular depolarization. So when there is defect in this phase, there is something problem with ventricular depolarization. You understand? Then T and U. T and U waves are produced during ventricular repolarization. Ventricular repolarization. So P wave is produced during atrial depolarization, QRS during ventricular depolarization, T and U during ventricular repolarization. You understand? In most of the ECG, we will not be getting U wave. So we will be talking about that later. So here we just understand this. And what happens in atrial repolarization? We haven't said anything about atrial repolarization, is it not? So this atrial repolarization, the wave is represented by TA, something known as TA. But what happens is, this is a very short wave and it is not seen in our ECG. Not seen in our ECG. Why? Because this atrial repolarization wave gets merged in between PR interval. In between P and R. In between this P and R, this atrial repolarization takes place, and it is a very, very small wave. Electricity is very, very small. So what happens? It is not depicted in our ECG. Understand? So this stuff today's class, there are 6 waves in ECG: P, Q, R, S, T, U. And P is concerned with atrial depolarization, QRS ventricular depolarization, T and U ventricular repolarization. And regarding the atrial repolarization, it is a very short electrical activity and it gets merged between the PR interval. So we told about positive and negative deflection, is it not? So there is some process which leads to positive and negative deflection in ECG paper that we will be dealing in the next class. So hope you have understand the session. Thank you for your listening. Thank you so much. Hoping for your support. Thank you.